this is Dr. Millie going live here in Toronto, and I'm just waiting for Paula Lovric to come on. She's going to give me a signal when she's here. Today we're going to be discussing heart disease. We're going to be talking about heart disease, the myths, as well as the truths. And heart disease is still the #1 killer in America. 1 out of 4 deaths in America happen because of heart disease, and yet it's a preventable illness. So we're going to talk about why this is. There's so many paradoxes when it comes to heart disease and why we're still living with heart disease for decades, years and decades, as well as dying from it. So being a preventable illness means it's nutritionally related, and I'm just going to wait for my co-host to come on, but I'm really excited to have her on because she's an educated RN and a functional medicine practitioner. And we're going to be talking today about all sorts of subjects, including inflammation and cholesterol and diet and lab markers when it comes to heart disease. And I'm really excited to be here. I just flew into Toronto this morning, actually, from New York. And so I'm going to bring Paula on camera. And just adding here. And so again, my name is Dr. Millie Lytle. I am a naturopathic doctor. I'm the founder of NatMed Coach. And NatMed Coach is a collective of holistic doctors and functional medicine practitioners and health coaches. And we are here to help the world be healed through preventable and natural measures. And I'm so excited to have Paula Lovric on the line today. Paula is a certified practitioner through the School of Applied Functional Medicine, and she's a certified health coach as well as a registered nurse. She graduated from her nursing program in London, United Kingdom, and specialized in neurology at the National Hospital Queen's Square. After moving to the United States in 1990, she worked at Memorial Sloan Kettering Cancer Center in New York City and was part of the interventional radiology team at Innovax in Fairfax, Virginia. She has extensive experience in several African countries, which certainly enhances her nursing positions and experience. And she's completed her training as a health coach at the Institute for Integrative Nutrition in New York City in 2015. And then she recently obtained her certification as a functional medicine practitioner through the School of Applied Functional Medicine in January of 2018. And I know Paula from the School of Applied Functional Medicine. We met at a retreat in Asheville, North Carolina in the spring. And this is our first venture working together. So I'm so excited to be here with you, Paula.
Yeah,
And thank you so much for coming on. How are you today?
I'm absolutely fantastic today. Very glad to be here with you discussing this very important issue of chronic disease prevention. Something I think we are both very passionate about, and we just want to bring it forward. We want to bring forward the ways in which people can get to the root cause of the chronic disease. And we just want to bust some myths today about the common practices that we all face in our lovely conventional medicine, that we all appreciate our current healthcare providers because of all the acute care life-saving measures and drugs that we are offered. However, when it comes to chronic prevention or disease prevention of chronic disease, we are sorely lacking. So this is really a passion of mine, and I'm very glad that you invited me on to discuss this topic. Thank you very much.
Wonderful. Yeah. So many people are living just their everyday lives, training for chronic disease, as I put it, through what they eat, through their lifestyle, through their habits. And it's really outside the medical system in a way to address that because it's what we're doing in our everyday lives. And the medical system has been set up to tend to our sickness and to disease
Absolutely.
and to emergencies. And so what we're doing in our everyday life sort of has fallen in this other realm of functional medicine, holistic healthcare, to educate people at home as to what they can do differently in order to prevent chronic disease, such as heart disease.
Exactly. When people know better, they do better. They just need to be aware. and the awareness needs to be raised on really what the issue is, or what the core issues are behind chronic disease. And we know that it's inflammation, and we know they're nutritional in origin. So with that knowledge, we can intervene at such an early point and really change the trajectory of the disease and the illness of people. So this is an area that I am very passionate about talking about, getting people to be more aware of. As you said, it's what we put at the end of the fork, Dr. Millie. It's what we eat every day. It's how we feel about our daily lives, the stress that we're involved in, the amount of toxins that we take in on a daily basis. I mean, many of us are not aware, and I certainly wasn't aware, that it was in my water and in my toothpaste and on the seat that I sat on and the mattress that I was sleeping on, and all that beautiful, lovely moisturizer that you put on your skin, realizing now that the skin is a big mouth and you're just ingesting toxins as if you put them in your mouth. So, I mean, these are the areas that we can begin to educate people on, make them more aware that it's inflammation that is really the cause, at the root cause of chronic disease. And we can reverse the itises. Many people talk about, it's just something that runs in the family. We've always been hypertensive. Oh, yes, I have achy hips or a rash. I get brain fog. I'm always lethargic in the afternoon. And people don't realize that these are inflammatory symptoms.
Yes. Yes. And so
Yeah.
you've mentioned this word inflammation. So let's break that down a little bit for people, because we do hear about this a lot. When you say inflammation, people might tend to think about joint pain, but they might not be thinking about what's going on inside their arteries or affecting their heart. So let's get more specific with heart disease, and what is this word inflammation, and how do we get
Yeah.
it?
Well, inflammation is basically the body's response to any threat or injury. When you fall, you hurt yourself, you cut yourself, healing, the process of inflammation is required for healing. Otherwise, we would all be bleeding to death on the ground. Similar dynamic happens when you have injury in the vessels, and that occurs when you have a process of oxidative stress. A lot of the pesticides and high glycemic foods that we take in cause basically very inflammatory molecules in the body that cause cells to become very inflamed, and therefore the inside of the arteries to become inflamed. And that in itself is a damage, and the damage is the inflammation, and the inflammation becomes chronic, it becomes systemic. And that process of oxidation is really where all the damage starts, requiring the help of cholesterol to heal. And that's when we have like a buildup of cholesterol in the vessels. Most people think it's, the cholesterol is the problem, and it's actually the injury, the inflammation, the inflammatory process that happened in the beginning. The cholesterol is actually trying to heal it. So I think
Right.
with
And
that
so
concept in mind,
go on.
yes, with that concept in mind, I think if people understand that dynamic, they can understand, the process of healing and why we've gotten kind of confused about what happens with cholesterol.
Yeah, because there needs to be some kind of lesion, right? There needs to be like a nick or an abrasion inside the artery wall, because the artery is made up of the soft tissue, just like on the inside of our mouth. We can think of this tube going all the way down our throat and in our digestion, but also our arteries and our veins are made up of soft tissue also. I mean, it's flexible, it's muscular, but it can get abrasions and nicks and things like that, especially when we smoke. If we look at the risk factors for what causes inflammation,
Oxidative
smoke,
stress, yes.
yeah, that creates oxidative stress, and it also depletes nutrients from our body. And also people who don't eat enough fruits and vegetables, right? This gives us a propensity for these lesions, so that inflammation can be, our bodies are responding when there's nicks or when there's something irregular. It responds with inflammation to try to heal that area. So
Yes,
yeah,
exactly.
and when it's not able
Exactly.
to address, it goes on for a long period of time, and then it becomes chronic inflammation. So that's what you're describing when you're describing the source of inflammation. And then you mentioned oxidative stress. So the word oxygen is in there, the word stress is in there. how do we think if we can visualize oxidative stress, what that looks like in the arteries, what's happening in the arteries? Um,
Yes, it's a
stress.
process of oxidation. Basically, a lot of the pesticides and all the toxic, high glycemic foods that we take in all have similar bullets in their gun, and they're called free radicals. And they're basically very toxic ions, highly charged ions that are radically free to go and burn any tissue or damage any tissue that they want to do. And this is what happens, usually in a very healthy body, or we have natural antioxidants that quench this, or we take in antioxidants that can quench it, and kind of mellow out the process. But so much of the modern day lifestyle doesn't allow for that dynamic to happen as much as it should. So therefore, we have this process of damaged vessels and damaged cells that through the process of oxidation, which is as a result of chronic inflammation.
Right. And so then this oxidative stress, so what are some examples of this, of the how this dynamic? So you mentioned toxins, you mentioned smoking, pollution, cleaning products.
Yes, I mean, one that people probably don't want to think of is simply overburning, meats. That lovely black charred grilled thing that people are often looking for is a huge example of what can cause oxidative stress in the body, and also obviously chronically elevated blood sugar. I mean, we have an epidemic of type 2 diabetes in the US. Not only that, but we probably have a lot of insulin resistance, which is the precursor, of course, to type 2 diabetes. And we have elevated blood sugar, which is basically causing oxidative stress in your vessels. So it's a very common dynamic.
Yeah. And so when there's these kind of chemicals that are floating around, or even sugar as a toxin in our body, but the blood doesn't like to have a high level of sugar. And that's why people who have metabolic syndrome, like who they eat too much sugar, also have high cholesterol while they go hand in hand. People tend to think, oh, if I don't eat eggs, then I'll have low cholesterol. But no, if you eat high sugar foods, that bagels every day or pasta every day, then you can still get high cholesterol even without a diet high in
Well,
cholesterol.
exactly. The total cholesterol people are very confused about. It's probably one of the most myth-ridden subjects known to man, because by the time you finish reading what the media have to say about it and someone else's rendition of what it is, but the facts are that the cholesterol that we take in really is not the same as the cholesterol that we have in our body. The cholesterol that we take in is really only 25% of what is added to the total body cholesterol, and half of the cholesterol that we take in the foods is not even absorbed. So the liver makes the cholesterol. Cholesterol is very important. We need cholesterol for healthy cells. It's very responsible for repairing cells and keeping all our cell membranes very healthy. We just get very down in the mouth when we get high LDL cholesterols. I mean, it is just unfortunate that we are focusing so much on the numbers rather than the type of type of cholesterol that is circulating, or the particle size, should I say, of the cholesterol that's in our. We need, unless we have sufficient amounts of cholesterol, then we will have issues with hormone production, because it's very key for the synthesis of our hormones, all our androgens, our cortisol, our estrogen, our progesterone, our testosterone. It's also necessary to make vitamin D, which is one of our very important vitamins. It's almost actually a hormone. So cholesterol is something that we really, really need, and it's not really affected significantly by the food that we take in.
Yeah. And so as the medical model is working to decrease cholesterol in everybody who's over a certain age of 40, as we're becoming concerned about men, their levels of testosterone dwindling, women, their levels of estrogen dwindling, all of us are low levels of vitamin D. And why can't we get vitamin D from the sun anymore? Partially because we
Yeah.
don't have the cholesterol on our skin anymore. And then also, you're right, you mentioned a good point in that dietary cholesterol, the cholesterol that we eat from our diet needs to be converted into cholesterol that then gets used in the body to heal the brain, to heal the cell membranes, to deliver the fat-soluble vitamins, vitamin A, vitamin D, vitamin E, to the cells themselves, as you mentioned, and then also return fat-soluble waste products to the liver so that they can get broken down again, and so that we can have, bile production and hormone production. And so all of these cycles that you're mentioning are so dependent on cholesterol. Cholesterol is this substrate, if you will. It's the main component of making our hormones. And if we're concerned with
Yes.
low hormones, and it's an amazing epidemic that we're taking statins, and yet we're being prescribed testosterone and estrogen as if we need them from the exterior, as if we need them in medication form when our body could just rightly produce those. Now, if they're not being produced and we have
Exactly.
enough cholesterol, there's another intervention that we can do. But this is what I hear you saying.
Yes, we know that that the cholesterol is a lot of the patients that are in hospital have, after having a heart attack, have normal cholesterol levels as well as high cholesterol levels. So that myth is debunked. We know that if the cholesterol levels are too low, as you say, we have hormone issues, and why would we start to give hormones for something that you just need to improve your production of good cholesterols. So yeah,
There's,
it's
there's this argument going on. I see people in my practice and they have a cardiologist, and their cardiologist is trying to keep their cholesterol low because they're following this cholesterol myth that heart disease comes from
yes,
cholesterol. And then their neurologist is saying, no, your cholesterol is too low. You're going to get dementia because we need cholesterol to heal the brain. We need a certain level of cholesterol to have a memory. And then we have this epidemic of blood sugar related illnesses that cause brain deficits, dementia, even linked. Diabetes type 3 is called, or Alzheimer's is referred to as diabetes type 3. So these things are all heavily linked to cholesterol. We have to really look at that and how cholesterol is functioning in our body and what the levels are. And
yes. I mean, it's changing. I mean, we know this. We've known this for a couple of decades. This is not new information. So
that's right.
we need to bring it. Yeah, it's not something that just, and it's scientifically proven. These are the damage and the cholesterol number is really no way to treat, because you're not getting to the underlying cause of the chronic disease, which is basically inflammation.
And then when the cholesterol faces inflammation, then we get something called lipid peroxidation. You might not want
Yeah.
to hear that word, or you might not be able to understand what it means, but it basically means that the fat is damaged, similar to the
Yes.
fat is damaged on the charred meat. And then when it gets damaged, when the cholesterol gets damaged due to low nutrition or not enough antioxidants, as you mentioned, and then it gets really sticky. And then it wants to stick to those along the artery walls, right? And so then that's how we get this kind of plaque buildup. That's how cholesterol creates plaque. We don't need high
Exactly.
cholesterol in order for that to even to happen.
No.
We just need some free radicals there, some oxidation.
And some damaged vessels.
Yes, exactly. And
Exactly.
then we've got a perfect storm.
Yeah.
And so this is really what's being missed in mainstream medicine when it comes to why we're so unable to treat heart disease and prevent heart disease, because we're just looking at this cholesterol number and not really paying much attention at all to the inflammation that's being generated, to the toxins that are there, to this oxidative damage that you mentioned, and
Exactly.
the free radicals. And so what would you say, Paula, are if somebody wants to go to their doctor and get checked out, right? They're getting their cholesterol
Mm-hmm.
taken, but maybe their doctor's focusing just on their total cholesterol. Some doctors are breaking it down and they're looking at their
Yeah.
particle size, or they're looking at their HDL, their good cholesterol, and their LDL, their bad cholesterol, or maybe even their VLDL, their very bad cholesterol.
Yes.
Um, so what are some markers? What is some lab work that people can request from their doctor to ensure that they're healthy otherwise, not just cholesterol?
Yes, but as you mentioned, Dr. Millie, the particle size is of extreme importance. And there are some lab tests out there that are doing that, although doctors are really not looking at those particular tests, that they actually show the type of particles within the LDL and HDL. Are they soft and bouncy that basically they can just bounce off the vessels and not cause any disease? Or are they the soft, are the small and sticky ones, the more atherogenic plaque forming type? So those kind of tests are really not being done streamlined yet, but there are a number of markers that can predict the overall cardiovascular health. And one of those would be the triglycerides and HDL ratio. That basically means you take your total triglycerides and you divide it by your HDL. The ratio that we really want is below 2. So that is really a good predictor that, even although your cholesterol is high, your inflammatory processes are fine, and there's not as big a risk of you as for getting an event or having an event, a cardiovascular event. And also the C-reactive protein is another regular marker that we do in conventional medicine. Obviously, we like it to be below 1. Anything in the 3 and 4 region indicates there's a significant amount of cardiovascular inflammation and an oxidative stress present. So, huge indicator that there needs to be some intervention there. Also, homocysteine levels, that's basically our cells' ability to clean themselves. Homocysteine is a methylation cycle. We won't go into detail here, but it's certainly something that we could discuss, when we see patients for consultations, that your homocysteine levels above 9 indicate that there's a lot of inflammation in your body. So, with those parameters, we can make a good prediction of your overall cardiovascular health. So those are, areas where you could talk to your doctor, and, your patients, just advocate for yourself, empower people to have this knowledge. And, we have to work with our physicians. We want our physicians to want us to be well. So we want them to be open-minded and be able to discuss these topics with us. Very important.
Yeah. So, okay. So we're talking about triglycerides. We're talking about LDL. We're talking about triglyceride to LDL ratio. We're talking about HDL.
Triglycerides and HDL.
Triglycerides and HDL ratio. We're talking about CRP, C-reactive protein, which is an inflammatory marker produced by the liver, but that circulates through the blood. So if we're wondering if we have inflammation in the blood, CRP is a direct measure of that. And then we can the interesting thing about these is that we can address them nutritionally.
Exactly.
With lifestyle. And so many people think, oh, I have familial high cholesterol, familial cholesterolemia. And so but the irony of that is the paradox, the Mediterranean paradox, is that people who come from Mediterranean countries, Italy and Spain and Turkey and these kind of Lebanon, these nations around there, where they eat a lot of olive oil and they eat a lot of fish, and they do tend to have higher cholesterol in their genetics, but they have less heart disease. And so we have to really look at this paradox, considering the fact that many people are aware that they should be eating a Mediterranean diet, but then they're still so nervous if their cholesterol happens to be on the higher side. And again, if we want the HDL to be above 45 minimum or 50, it's a bit different in women and in men, then we also have to account that that's going to raise the total cholesterol as well. And it's not a bad thing.
Exactly.
That's why the ratio.
Because we know our HDL has protective qualities and actually carries damaged, oxidized LDL back to the liver for recycling. So we need that. And as you say, it increases the overall total cholesterol. So it is really outdated that we are treating cholesterol numbers.
Yes, yeah. And so then you also mentioned homocysteine, which is also becoming, I mean, this is something we've known for 20, 25 years, that we need to be testing homocysteine to assess risk of heart disease. Involved in the methylation cycle, as you said, which involves B vitamins. So again, nutritionally related, it can be genetically linked, and we can also assess that if somebody has the genes that are exposing them to high homocysteine, or if it's just due to their lifestyle, a poor nutrient diet, or poor liver health, too much Tylenol, ibuprofen in there.
Yeah, absolutely. I agree totally.
And so, we've kind of like, the thing about statins is that our statins always bad. I mean, we in holistic health, we in naturopathic medicine and health coaching, we do tend to, I tend to talk to people about their statin use all the time because they produce so many side effects, so much myalgia, muscle pain, fatigue, again, all of these symptoms of aging, as we call them. could be due to just to your run-of-the-mill, everyday kind of one of six medications that you're taking, the statins.
Absolutely.
So, but
Yeah,
are
well,
they, are they always bad, or what's your impression of that being a nurse and you're kind of in the medical system? So you kind of straddle this dynamic between being in the hospital taking care of very sick patients and then also moving yourself into functional medicine and health coaching.
yes, I mean, if we know drugs are toxins, and at best they should be taken for short periods of time. I mean, medications are a great triage in many instances until you can make the lifestyle changes necessary to actually reverse the dynamic. But statin drugs, are they always bad? I mean, there's definitely conflicting feelings around at the moment. But I mean, the incidence, they're actually anti-inflammatory in origin. Cholesterol drugs, statin drugs, which is actually what we want. And they would be so bad if they didn't actually affect the production of the cholesterol from the liver. So they're actually just shutting off the metabolic pathway that produces cholesterol. And in doing so, as you mentioned, they're shutting down one of the very important enzymes we need for cellular energy and cellular respiration and for the health of our mitochondria, which are these little energy factories in our cells. And we have cells, these mitochondria, all over our body. We have them in our neurons, we have them in our muscles. So the high risk of having issues related to dementia and a lot of problems are underreported of statin use. Areas where they have seemed to really make a huge difference is if someone has had a cardiovascular event, they prevent the onset of a second one quite significantly. So unless you're really someone who has a lot of comorbidities, I mean, other disease processes going on, and that you've had a heart attack, the literature doesn't really support them for the prevention of heart disease because they don't significantly improve your chance of not developing it.
Yeah.
So the other area with statin drugs is for menopausal women over there's a 71% increase in developing type 2 diabetes. So these are pretty significant issues that, there's a place for everything, but it's a short-term place. That's the belief that I'm coming up with the knowledge of both conventional and functional medicine at the moment.
Yeah, it's a pretty serious trade-off if we're facing diabetes as an epidemic
Exactly.
and also heart disease as an epidemic, and we're kind of misapplying a medication towards prevention of heart disease only to give us diabetes. And also the fact that depression is so linked to heart disease as well. And if we're taking these statin medications preventatively, and they're impacting our energy, our ability to produce energy, and then feeling tired and in pain and sluggish and not being able to be as active as we want, play golf or soccer or pick up the kids or grandkids. So this also factors into our mood and our mental health. And so we have to look at the overall burden of disease and what the risks are, the trade-offs, the risk versus benefit of
Exactly.
statins. That really needs to be re-examined. I think that's a massive problem, as well as the fact that because we haven't solved heart disease through the lowering of cholesterol, we keep lowering the level of cholesterol. The new guidelines come out every 5 or 10 years, and we need lower cholesterol all of a sudden than we did 5 or 10 years prior, and we're applying statins to that because we still only have this one kind of fix. Well, we have
Yes.
aspirin as well. We have blood thinning as well, but
Well, that's another that's another lecture.
okay,
Yes,
so we won't
it
get into
is a
that today.
huge.
Tune in another time when Paula and I just
Tune
jump
in for another one.
to
Exactly. No, these are that's all great truths. There's, what I see on a daily basis. I mean, I've been on the front line with chronic disease, caring for patients with chronic disease for 25 years now, and it's not getting any better. It's getting worse. We have more diabetics than ever, type 2 diabetics, and we know that 4 to 6 times more likely to develop heart disease than anybody else. So we have the potential of having more heart disease. And, what I see is, my average patient that I see on a daily basis is on 10 to 12 medications. So we're treating disease, but we're not getting to the underlying cause of why that disease occurred. And, having that huge opportunity to be able to do that, I'm very, very passionate about doing that, because I've seen chronic disease in its extreme cases. I've seen patients on dialysis. I've seen patients lose limbs. I've seen patients with no eyesight as a result of chronically elevated blood sugar and out of control entrenched diabetes. And as we know, the remedy is, what you put in your mouth and how you live your daily life to a great degree. Interventions that can be done very early on to reverse this condition.
Yeah.
So,
or even once chronic disease is diagnosed, we believe that we can prevent and reverse that through nutritional interventions, and then prevent the extreme interventions of surgery and all the extreme horrors that you see and are unfortunately so common.
Yes. Well, as we say, any itis can be reversed. Diverticulitis, sinusitis, anything that ends in an itis. Itis just basically means inflammation off. So if it's inflammation off, there are many interventions that we can do and get people to do to get rid of that inflammation, which is, of course, the root cause of chronic disease, the onset of chronic disease. So I'm very excited. I mean, I'm torn in many, many ways, because I am very passionate when I see my patients suffering, and just so many of them, and they're younger. I mean, they're getting younger. So modern day lifestyle, we need to take a really good, sharp look at what people are putting in their mouths and start the awareness campaign about negotiating a supermarket, being able to know what you're putting in your mouth is of extreme importance. And I think that's a great place to start with people, because I think there's a huge opportunity to educate in that area.
Absolutely. And so this is what Paula does in her professional life, in her professional functional medicine practitioner role, as well as health coach role. And if you would like to address the itis of heart disease, which I guess is arterioscleritis or atheroscleritis, which we don't tend to, medicine doesn't speak about that. They just jump to the osis already, which is
Yes, the osis, and that's the next stage on.
yeah, that's once the degenerative process is already set in. So if we can, we believe that we can fix your arterioscleritis and your atheroscleritis, and Paula can certainly do this with all of her bookfuls of knowledge, encyclopedia fulls of knowledge. And if you would like to contact Paula and work with Paula, then you can go to healthfullring.com. This is her website. Healthfull, that's FULLRING.com. So HEALTHFULLRING.com. I'll put it in the comments so you can check out her amazing website, which really lists specifically the conditions that she helps to prevent and treat with her vast experience. And you can also follow her and send her a note on Facebook at facebook.com/Paula, PAULA, .LOVRIC, that's Lovric, .96. And wouldn't you want, as a heart patient, to be, treated by somebody with the last name Lovric? I would. So Paula.Lovric.96. And also she's, of course, attached to this live call. Paula, so, there's so many things that we could talk about. We could talk about hypertension, which we haven't even touched, and that's a huge topic. I don't know if you want to maybe mention something about how hypertension fits into atheroscleritis. We've developed a new condition. We're naming it right here. Or and maybe give your takeaway on that, because so many Americans are suffering from high blood pressure.
Yes, high blood pressure. They just changed the guidelines last year, and
another
now we have
example.
probably more than 3 million more people who have the label of being hypertensive
Yeah.
The numbers have come down from 140 over 90 to 130 over 80. And this number, just adds the potential of people, more people being put on medications for their hypertensive state. We know that hypertension is basically the driver of atherosclerosis. The hypertension, in the vessels over time, it's just like a hose pipe. If you have high pressure going through constantly, there's going to be little nicks in the vessel, and that's the opportunity for some, oxidative stress to happen, inflammation, buildup of plaque, and there is the dynamic of, atherosclerosis. Basically, as you mentioned before, it can become oxidized and become inflamed. And it's just a huge dynamic precursor to heart disease. Hypertension can be caused by many different things. There's a huge stress. We haven't even got into that, but the component of stress involved in hypertension is huge. And it's an area that people really almost feel that it's intangible. It's kind of almost, it's there. Stress doesn't really affect my body in any physical way. I mean, yes, I get nervous, but there is a huge effect of stress hormones on your cardiovascular system. And over time, if those areas of stress are not dealt with, you just have chronic, hypertension. So these are areas that we look into, and we're not just talking about physiological, mental, emotional stress as I don't like my boss, or I hate my life, or I don't like where I live. You're talking about physiological stress. Maybe it is a low-grade inflammation in your gut. Maybe it's just a dysbiosis. Maybe it's an imbalance in the good bacteria and the bad bacteria that's causing this inflammation, and then your cortisol levels do rise, and therein lies the dynamic for the onset of chronic disease, hypertension. So it all has its core in inflammation, and that's basically the root of it.
Yeah, so I mean, there's two different kinds of hypertension, essential, which is the stress version, and then there's the secondary hypertension, which does come about, as you mentioned, the narrowing of the lumen of the arteries because these plaque buildup, and then all of a sudden you had an artery that was half an inch wide and now it's a quarter of an inch wide, and the same amount of blood needs to fit through it. So it creates all this pressure. And just like you mentioned, if you cut off a hose, pinch a hose, and what's going to happen? It's going to explode, and that's what it looks like when we have a red face and
Yes.
tentacles coming out of our neck, and so we can, or like the curve in the ear, all these kind of hallmark signs of hypertension, and how we can just look at a person and sometimes see that what they're experiencing. But as you mentioned, hypertension, there's so many causes to it, and it presents differently in different people.
Exactly.
And so people really do need an individual consultation to learn how to manage it for themselves, what the cause is in their individual physiology, what their personal risk factors are, if it's sleep or sugar or emotional stress or
Absolutely.
shift work
Well,
or gut inflammation.
well, this is where, in functional medicine, we really do a deep dive into the health history, and it's a lot of investigative work and interconnectedness that we see, and we can connect the origins of disease, and we can connect the imbalances and the insufficiencies, and what we see in conventional medicine is we see statistical norms in lab results. In functional medicine, we're more looking at what's optimal for the individual, because it changes from one person to another. So we are looking at the insufficiencies and the deficiencies and the imbalances, and the plan is to correct those. And when those are corrected, then the body has just an amazing ability to heal itself.
Yeah, and that's why prevention works, and that's why we can do prevention. That's why we can see disease before it starts, so to speak. This kind of magic illusion of us, in naturopathic medicine and functional medicine and the holistic side, because we've learned this interplay between the organs and the connectedness of inflammation or stressors or the adrenal glands, or the gut, as a root of all disease. So, Paula, I want to thank you so much for being here today. It's been an amazing conversation.
Yeah, I really enjoyed it, Dr. Millie. I really have enjoyed it, and
And
I really am going to bring this message forth. Happy to help anyone who is looking for a better way or a different way of getting to know what's going on with them.
thank you so much, Paula. And so again, you can reach Paula on her website at healthfulring.com. I'll put it in the comments, as well as on facebook.com/paula.lovric, Lovric .96. And I also want to invite everybody out there to tune into Virtual Health Club, which is NatMed Coach's online group coaching program. We offer a minimum of 4 coaching calls per week on a variety of topics. It is a private Zoom call. It is something you need to register for. And we're offering the first month is absolutely free. So I'm going to put the link if we'd love for you to join. This was our
Mhm.
pre-launch here with Paula. This is a taste of what you're going to see on the Virtual Health Club, except for in Virtual Health Club, you're going to get an opportunity to have some coaching by our experienced practitioners such as Paula and some other coaches and functional medicine practitioners, as well as naturopathic doctors that we've got on our team. And we're so excited to present this to you. I'm going to be presenting the first session on Monday, discussing something a little more esoteric, talking about your horoscope and your health, and how your birth date, how that applies to what your overall health picture looks like, and how you can address prevention strategies from that. And then coming up on September 4th, we've got health coach Ali Might. She'll be talking about seasonal eating and how to use this season's best into your recipes, into your seasonal recipes, seasonal eating. And then on September 15th, we've got Dr. Patricia Pimentel-Selassie discussing a better brain, how to have a better brain. And Paula and I touched on a few topics today involving cholesterol and sugar, but there's certainly more, and she'll be delving into that for an hour and taking your individual questions. So I hope that you'll join our health club, consider joining. It is a $29 a month membership, but we are offering the first month free so that you can dip your toe in without any commitment and see how you like it. And once you register, then you'll be signed up for all the future uh, coaching conversations. And Paula, I can't wait to discuss with you in the future more about
Yes.
hypertension, more about calcium and plaquing, and where all that calcium, what's happening to all that calcium that we're
Oh, yes,
ingesting,
that's another topic. Yeah,
why
exactly.
it's not going into our bones, why is it going into our
I
arteries.
know. Wow. A little thing called vitamin K too.
So let's talk about that
And
in the
some
future.
medications.
Let's talk about that in the future. I would love for that to be our next call, and you'll be able to tune into that. We'll announce that if that's going to be on Facebook Live or if it's going to be on the Virtual Health Club. So thanks everybody for tuning in. We want to thank you so much for spending your Saturday morning with us, or whenever you happen to be listening to this. Again, thank you, Paula. Have a great weekend.
Thank you, Dr. Millie. You have a great weekend too. Thank you very much.
Thank you.